Good morning, and I'd like to start by thanking again WXXI for their willingness to host our remote press conferences, and to the rest of our local press corps for their cooperation and continuing partnership in ensuring that we're able to get important information out to the public, while at the same time upholding our responsibility to maintain safe social distancing practices. We're here today to discuss the plans that our community has put in place for our healthcare system to withstand whatever surge the COVID-19 outbreak may bring to our community. And I'm grateful today to be joined by Dr. Mike Mendoza, the Monroe County Commissioner of Public Health, Dr. Michael Apostolakis, the Chief Medical Officer for the University of Rochester Medical Center, Kathy Parinello, the Chief Operating Officer of the University of Rochester Medical Center, Dr. Robert Mayo, the Chief Medical Officer for Rochester Regional Health, Dr. Bafshar, the Chief Quality Officer from Rochester Regional Health, and Hugh Thomas, the Chief Administrative Officer, again from Rochester Regional Health. And today, we are here to announce our collaborative COVID-19 surge capacity plan. Hospital surge capacity is a topic that's been on the top of our community and communities across the globe in recent weeks, and understandably so. We've all seen the images and heard the stories of hospitals that have strained to deal with increasing numbers of individuals infected by the virus. Once COVID-19 reached Monroe County, it quickly became clear that we were going to need a community-wide effort to ensure we're ready and able to care for our residents. Our community is blessed to have two incredible health systems in the University of Rochester Medical Center and Rochester Regional Health, and I'm grateful that they each answered the call to make this a collective effort. Over the last several weeks, I've convened daily calls with both systems, as well as representatives from the county and state health departments to review existing capacity and determine how best to expand the number of available beds. These conversations became even more important once Governor Cuomo mandated hospitals increase capacity by at least 50% with the goal of 100%. Working collaboratively is important because despite the fact that we have two major hospital systems, we are one community and our response should be as one. The plan that was developed in this process involves a phased approach, allowing the systems to repurpose and increase capacity within URMC and Rochester Regional's existing facilities, as well as a final phase that involves the creation of a field hospital should additional capacity become necessary. This plan gives us a path to create more than 2,000 additional beds should we experience a surge in patients. Across 3 phases of expansion, medicine, surgery, or ICU bed capacity will gradually increase by a total of 103% at URMC and 109% at Rochester Regional Health. If all 3 phases are ultimately implemented, the total number of beds available across both hospital systems in our region right now over the 3-phase plan has the potential to increase from 1,964 beds to 4,044 beds. Phase 1 of the plan has already been implemented through a process of freeing up beds and decreasing non-urgent surgeries and procedures. This phase ultimately led to the opening of 647 additional beds throughout our community. Phase 2 involves converting hospital, overflow, or ambulatory clinics into patient care spaces to add another 761 beds. If additional beds are still needed, Phase 3 would entail doubling up on non-COVID patient rooms and converting non-clinical hospital space to support patient care by adding beds, staff, and equipment, which would allow our systems to add yet another 672 beds. The final phase, Phase 4, would create a field hospital to care for non-urgent recovering COVID patients, which would in turn free up even more space in local hospitals for those in need of critical care. My team has been working hard at work planning for that scenario. We've identified 4 locations throughout our community that could be used as field hospitals, and we are in discussions with the owners of each regarding capacity and logistics. A field hospital would be a big undertaking and would require both state and federal support. Those conversations have already begun. We've communicated these needs in our plan to Governor Cuomo's office so that they are aware of what we would need. And this afternoon, we'll begin the process of touring and looking at those sites with our partners from the medical community, Monroe County, and the State Department of Health. Monroe County is in uncharted territory, but I'm working closely with our hospitals to ensure that the sick or injured people in our community get the care that they need when they need it. Though we continue to impress upon everyone the dire need to stay home and to practice safe social distancing to avoid large surge in patients, I want this community to know that we are working very hard to be prepared if more hospital beds are required. Before I turn this over to my partners from the hospitals to discuss their plans in more detail and be able to answer your questions, I want to say once again what a privilege it is to lead this community. We are incredibly strong and resilient, and I am inspired daily by the collective efforts I see going on across our community to ensure we stay safe, healthy as possible, and that we come out of this on the other side. This plan that we're announcing today is a collective effort, but so are the countless community and organizations ensuring our seniors, struggling families are cared for and fed. So are the volunteers who are the lifeblood of those same organizations who have never had to tackle needs that are great as the ones we're facing today. And so are the businesses and organizations who are donating supplies and materials or changing their entire business plan or manufacturing operations to ensure our community can respond to this current crisis. And so are the individuals and families I've seen in my neighborhood and in neighborhoods across our community who put a rainbow in their window or draw a message of hope on their sidewalk with a chalk in hopes of brightening just one other person's day who's out there in the community. We're all in this together, and I know if we continue to help and care for one another, we will get through this together. And if I could leave you with one takeaway, it is this. While our hospital systems are working diligently and our healthcare professionals on what makes sense as a phased-in approach to meet the needs as it grows within our community, we all have the chance and the opportunity to impact those phases and to impact those needs. It was about 10 days ago where we started to shut down non-essential services throughout this community. It was about 10 days ago that we made that hard decision to close schools and to start to close all those social gatherings and reduce the number of people who can become together and to start to implement social distancing techniques. And it's by doing that that the healthcare systems can manage that surge and can manage what's happening here in Monroe County. There's a lot of different models out there that talk about what can happen as it relates to COVID-19 spread throughout the community when the community does nothing in terms of social distancing and we just carry on business as usual, or if we decide to do things like close down schools, close down universities, and stay at home unless there's an essential service. The results really are in our hands. The studies have shown that if we take the social distancing measures that we are taking, our communities can experience a decrease in up to 80% in the spread, and we can spread out the length of time that the cases come to our community. So think about that real quick, because I know this isn't easy. My family, too, is home, and they're stuck home, and there's not a lot to do. But what we're doing in staying home and getting through this is having an impact on the healthcare community. It's having an impact on the vulnerable older folks who are in this community who could be more severely impacted should they contract this disease. We all have a role to play in protecting our neighbors and protecting our community. So if you do not need to be outside your home, you need to stay home. And the proof will be in the numbers. As we start to track this and we start finding evidence as we move forward that we can lower that curve and that we could spread out the impact of this disease, you will know that what you're doing has been worth it. When our community comes through this on the other side, all this, I will just say it, this painful experience we're going through, this isolating experience, which I know it is, and the hard anxiety and troubles that our families are going through right now will be worth it if we can lower the curve and get through this as a community. And so I want to thank you on behalf of all those professionals out there in the healthcare world, the nonprofit community, the law enforcement community, EMS, our firefighters, the healthcare workers who are working in nursing homes and long-term care facilities, all those folks at the grocery store, people who are going to work every day right now because they need to provide those essential services. I want to thank everybody else in our community for doing what your part to keep them safe and to lower the spread of this disease and to spread out that curve. That is the role that we can all play to make sure that the surge capacity plans that we're announcing today, the field hospital plan that I laid out at Phase 4, hopefully will never become necessary in this community, because we are all stepping up to the plate to do what we do best, and that's care for each other as a community, and we'll get through this. So thank you very much, and I want to next invite up to the podium Dr. Michael Apostolakis, the Chief Medical Officer at the University of Rochester Medical Center.
Thank you, County Executive, for your message and this opportunity. For months now, UR Medicine has been working with the county and the state Department of Health and our colleagues at Rochester Regional Health System to make sure we can manage cases of COVID-19 that come to our community. Today, we're here to talk about our hospital's surge plans for the potential cases to come. I want to remind everyone that the large majority of COVID-19 cases are mild and do not require hospitalization. All they require is isolation at home and symptomatic treatment. For those, though, who do require and become seriously ill, the vast majority of those also fully recover. At UR Medicine, our hospitals are working together to care for patients across our region. All UR Medicine hospitals are prepared to provide safe inpatient care for COVID-19 patients who need inpatient care but aren't critically ill. Those hospitals include Strong and Highland in Rochester, F.F. Thompson in Canandaigua, Noyes Memorial in Dansville, St. James in Hornell, and Jones Memorial in Wellsville. Strong Memorial Hospital is set up to safely treat COVID patients who are critically ill and require intensive care. Strong has the largest number of ICU beds, intensivist doctors, and equipment to treat those critically ill from COVID-19. I would also add that the illness, that although the illness of COVID-19 is novel to the area, the end result clinically is something called acute respiratory distress syndrome, which we are very familiar with treating. So we can take care of the very ill COVID-19 patients. Our surge plan includes temporarily shifting less critical surgeries to Highland Hospital and F.F. Thompson Hospital to maintain capacity for these critically ill patients at Strong. Our hospitals have met the governor's request to develop plans that more than double our current capacity. Across the 6 UR Medicine hospitals, we have created a surge plan that includes the addition of more than 1,999 inpatient beds. That's a 103% increase over our region's normal capacity of 1,066 beds. At Strong Memorial, we have about 200 inpatient beds that are immediately available. These became available by avoiding or postponing postponing surgeries that could wait over the next 6 weeks without causing harm to our patients. Our plan will enable our plan will continue in Phase 2 with the addition of at least 400 more beds. The surge capacity plans help us make ready to treat large numbers of COVID-19 patients. However, we are working hard to ensure that the full extent of these plans won't be needed. That brings me to the most important part of this message that you've heard over and over again. The public plays a huge role in what happens in the future. This is not simply about capacity, it's about demand of beds. The more social distancing we practice, the more that people take the governors and the county executive and other officials, health officials' advice to stay home, will save the hospital's capacity and enable us to care for everyone and reduce mortality. It truly is a life and death situation for everybody in the community to take seriously. So I remind you of the advice given by Governor Cuomo, County Executive Bello, and Dr. Mendoza from the Health Department. Remain at home to the greatest extent possible. If you do go out, avoid crowds and practice social distancing. Wash your hands frequently and thoroughly. If you feel sick, stay isolated at home. And if you think you have COVID-19, call a medical professional before coming to a doctor's office or urgent care. If everyone in the community will follow these simple guidelines, we can flatten the curve. The number of COVID-19 cases will grow at a pace that our hospitals can handle without the extraordinary measures we are planning to make. It's the job of our health system to prepare for the worst as we hope for the best. But we will need more than hope. We need the help from the public by taking the steps that will limit the spread of this disease. With that, I will introduce Dr. Kathy Pernello, the Chief Operating Officer at Strong Memorial Hospital, who will provide some brief details on our surge capacity plans. Thank you.
Thanks, Mike. Before I describe our plans, however, I want to thank our community for the outpouring of support all our hospitals and healthcare workers are receiving. The donations, the words of encouragement mean the world to our teams as we prepare to care for the growing number of COVID-19 patients. I also want to acknowledge our UR Medicine patients and families. They have been incredibly understanding about the changes we've been forced to make during the COVID-19 crisis. Not allowing visitors, delaying procedures and appointments to our physician offices has been difficult for everyone. Our health system appreciates your patience and understanding as we take these steps to ensure safety and access to care. So now for our surge plans. On Tuesday, all 6 UR Medicine hospitals submitted surge capacity plans to our state government. Our plans are based on 3 phases of expansion that can be implemented as needed to add bed capacity to our hospitals. We have distributed a chart that details the number of beds each hospital could add and in each phase. Phase 1 includes beds that are staffed and immediately available. And this is space, as Dr. Apostolakis just said, was created by delaying non-urgent surgeries and procedures. In the Rochester region, our hospitals generally operate at 100% capacity or higher. By delaying these urgent cases, or by delaying the non-urgent cases, we have made more than 300 inpatient beds available at Strong, Highland, Thompson, and our other regional hospitals. We are now grouping these beds on our hospitals into units that will be ready to care for COVID-19 patients, as well as care for the other patients that require hospitalization during this period. We can staff these beds with our doctors, nurses, and other staff members who already work at the hospital and can be redeployed from outpatient facilities. In phase 2, we would create new inpatient beds using clinical spaces in the hospitals or ambulatory facilities, such as for us, our Sawgrass Surgical Center. This phase would create nearly 200 new beds at Strong, 80 at Highland, and 33 at FF Thompson. That's 320 additional beds total in the Rochester area. Setting up these spaces would require more effort and resources than in phase 1 because they are not today designated for inpatient care. We're developing non-traditional staffing approaches to provide care in these new beds. We're moving to a team nursing approach, for example, moving away from our traditional ratios. And we're talking to many of our physicians who are currently not working in their offices to help provide care in these areas. Phase 3, if we need it, would be more challenging for our patients and staff. To create these beds, we would double up on our non-COVID patients who are currently in private rooms to free up more rooms for COVID patients. We would also need to bring in beds, equipment, and outside staff to convert some non-clinical spaces to patient care. This phase would create an additional 380 beds in the Rochester area. We have explained to our state and county officials that UR Medicine would need outside support to add these beds. Implementing Phase 3 will be a sign that our community's health system is on the verge of being overwhelmed. But as our medical experts have said, as Bello has said, the public can play a huge role in helping us avoid reaching that point. Social distancing, as you've heard over and over again, is the #1 strategy our community can use to slow the spread of this disease and keep the number of patients with disease at a number that we can manage. Before closing, I want to thank all of our public officials, Governor Cuomo, our state senators, Schumer and Kristen Gillibrand, Joe Morelli, our congressman, Adam Bello, Dr. Mendoza. These individuals have been very deliberate and enthusiastically sharing the message that social distancing is important. It will be key to the success in our community. Also, in closing, I just have to thank all the over 1,000 physicians we have at UR Medicine, our over 800 advanced practice providers, over 4,500 nurses, 2,000 clinical technical workers who work in our hospital, our primary care office, and in our clinics. And then there's about 1,000 more of those individuals that work in our affiliate UR Medicine hospitals. Many of them have taken alternate assignments, they're working different shifts, and they're caring for our patients in new and different ways. Their commitment remains strong in the face of COVID-19, and their compassion has not waned. I'm proud of our team, and I know they will do all they can to provide the highest standards of care for our community during this crisis. Thank you very much. It's now my pleasure to introduce our colleague across the community, Dr. Robert Mayo, who's the Chief Medical Officer at Rochester Regional Health.
Thank you very much, Kathy. It's good to be here with our colleagues at the University of Rochester and Monroe County. It can't be said often enough how important this collaboration is, not just at the leadership level, but at the public level. So I want to start by thanking all of you for doing what you can to adhere to the social distancing recommendations, hand hygiene, environmental cleanliness, and all of those important steps each day that you take to keep yourselves, your families, and this community safe. I know it's been difficult for students not to be in school with their friends and to feel that type of camaraderie, as well as for the rest of us in our workplaces, but the importance of these steps remains paramount in our collective fight against the COVID-19 virus. The Rochester Regional Health has been actively involved in partnering and in following and implementing the same three-phase steps to surge capacity. Surge capacity remains vital to our plan in supporting this community, and Rochester Regional Health is eagerly and actively preparing and implementing steps for that. I'd like to share a few of those things that have already occurred and things that are yet to be implemented. Starting with the concept of social distancing, we have over 800 of our providers now seeing about 70% of their day-to-day patient load through telehealth. This has been a huge advance forward, and we're grateful that the community has adopted telehealth opportunities so that we can continue to care for you without having you in the office. Additionally, we've placed 4 locations of exterior tent evaluation environments. And these environments are seeing many patients a day, sometimes in the hundreds, and they have provided ready screening for community members to understand if their symptoms are concerning for COVID and whether or not they need to be tested. Those locations are at the Wilson Center next to Rochester General Hospital, at Unity Hospital, United Memorial Medical Hospital in Batavia, and at Clifton Springs Hospital and Clinic in Clifton Springs. We've also redirected over 500 members of our clinical staff, nurses, technicians, and physicians who are now being trained to function as care providers in environments that they are not typically familiar. So these outpatient clinicians are now learning inpatient practices and skills so that they can support surge capacity if it becomes needed. Similarly, we are also evaluating all of our clinical spaces and expanding the access of acute care through non-traditional spaces in our hospital, through filling currently empty spaces that have been created by reducing our non-urgent patient care, as well as creating new clinical spaces in non-traditional environments. All of these are scaled based on staffing ratios, the skill mix that is needed to care for these patients, as well as potentially cohorting different patient types, not necessarily only COVID patient cohorts. All these efforts are meaningful as we fight the COVID-19 pandemic. We are also actively partnering with Monroe County and the U of R in the field hospital, and will be happy to support any other initiatives that this community feels needed to keep our citizens safe and healthy. So I'd like to close again by thanking you for all the sacrifices that you're making every day. It really does matter. Please don't fatigue of the social distancing. It feels odd for all of us, but it is far and away the single most important thing, and it's something that you can do. And so thank you very much.
Okay. Thank you again for the participants in today's press conference. And now any of the folks who are here today from the hospital systems, again, I have Dr. Mendoza with me here as well, can answer questions from the media.
Okay, first up we have Wendy Wright from Spectrum News.
Thank you. It's good to see you all well. I had a question in regard to ventilators. I know you're freeing up a lot of space as far as...
I'm sorry, Wendy, you're breaking up. I think we'll go to our next reporter. Wendy, can you just
this is a little bit better.
Oh, that is better. Go ahead, Wendy.
Okay. We have these extra rooms that you're talking about. What about ventilators? Will there be enough ventilators? And also the staff, I know you're discussing staff, but the ventilators, how many of these rooms are ICUs?
Approximately 25% of all hospital admissions require ICU level care, and a percentage of those, the majority, 80%, require ventilation on a mechanical ventilator. We currently have capacity for to ventilate up to 400 patients in that way. Right now, I can tell you at Strong, we have approximately total 70 patients on a ventilator. So we have quite a surge capacity for that at the present time.
Do you have a follow-up, Wendy?
Yes. I just had a quick question in regards to the younger people with the child who is under 10 who is diagnosed with COVID-19, and even on the list that was just released, there are 3 in their 20s. I don't know if this is best for Dr. Mendoza, but wondering if you are seeing more young people than was originally discussed.
Good morning. In response to your question about the demographics of the individuals who have been diagnosed with COVID-19, again, remember that what we are seeing is a factor of who we are testing. And so there is a little bit of a selection bias with regard to the numbers that we are seeing. We know that the average age of the individuals who are in the ICU in this community at this time is 65 years old. And the average age of those who are hospitalized but not in the ICU is 61. So while we are seeing a number of individuals across the community being diagnosed with COVID-19, the vast majority of those who are needing advanced levels of care are in their 60s.
Thank you. Next, we have Jennifer Lukey from WHEC TV. Jennifer, are you with us?
Yes, I'm here. Sorry about that. I'm wondering what phase we are at right now in this plan, and if we continue on this trajectory, how long until we reach phase 4, which is that field hospital?
This is Rob Mayo chiming in here. We're well into phase 1. That was the phase where we opened up current capacity by reducing non-urgent surgeries and office visits. That has been incredibly helpful. It has opened up several hundred beds in our hospitals, both at U of R and at Rochester Regional Health. We're now really launching into phase 2, which is, how do we prepare those spaces for increased inpatient demand. So if increased inpatient demand starts to surge, those beds will be filled first. So that is phase 2. And then phase 3, as was previously explained, is the expansion into non-traditional spaces. What this means is sometimes using hallways for patients that do not need a more critical care or intense environment. So our less sick patients, sometimes doubling up in rooms. And so that would be phase 3, and then that then moves into the phase where we have the field hospitals. So we're still early into the graduation of these phases and in their rollout.
Do you have a follow-up, Jennifer?
Yeah, I guess I'm just wondering timeline. I'm sure you had to provide information to the state of New York as far as your projections. Do you project we could be well into phase 2 by next week, next month? I mean, under these current circumstances, what is the further outlook of this?
So I would respond to that by saying that this chapter is yet to be written. The extent to which we succeed as a community with social distancing, all of the measures that we put into place will determine if and when we even need to go to phase 2. If we can manage to stay home, if we can manage to only limit people who are essential to going to work, very frankly, we may never need to get to phase 2, and that is certainly our hope. As to when that would happen, again, it would depend on how well we work together as a community.
Our next question comes from Jeremy Moore from City Newspaper.
Okay, I'm here. Sorry. I'm just wondering, a lot of numbers getting tossed out. One thing I didn't catch or didn't hear, how many ICU beds do we have locally? I know the gentleman from URMC mentioned what they have.
Yes, this is Kathy Parnello, and I just conferred with Dr. Rob Mayo. We have about 145 at UR Medicine and a little over 100 at Rochester Regional ICU beds in our community today. And I'll just make another comment, too, around the question of where we are. The State Health Department is doing the absolute right thing by requiring that all hospitals every day report on the number of available med-surg beds, the available ICU beds, and the available ventilators that could be used. So we are, all hospitals across the state are tracking that information and submitting so we can monitor very carefully across our entire community exactly what's going on in terms of use of hospital beds.
Okay.
And your follow-up?
Yeah, I just want to piggyback on the earlier question about the ventilators. In terms of supply, where are the Rochester region hospitals on ventilators? Do you feel like you have enough? Do you feel like you are not anywhere near well equipped for them?
This is Rob Mayo responding to that question. I would answer it this way. We know that we have very capable clinicians that can manage these ventilators. And we have an important resource that we will use to care for our community. As the need arises, if that day comes, we will be petitioning the state and federal governments for more ventilators. And that process is already open to us. There are other machines, like anesthesia machines, that can be adapted into ventilators. And so there are, that expands our capacity to support patients with respiratory failure significantly. In addition to the traditional ventilators that have a certain characteristic group that are used for certain types of patients, we can prioritize respiratory failure patients using other ventilatory support mechanisms that are not the traditional ventilator. So I don't think that we should be focused just on the number of ventilators. We can manage many more patients with ventilatory compromise than just the number of ventilators.
Thank you. The next question comes from Brian Sharp at the Democrat and Chronicle, and following him will be Brett Dahlberg from WXXI, so stand by, Brett. Go ahead, Brian.
Thank you. Can you address, or can somebody address by phase what are our needs, where our gaps exist in equipment, be those ventilators or otherwise, of what we'll need for each phase to meet the beds that we've talked about?
Yes, this is Kathy Parnello. And as we've reviewed the phases, we believe phase 1 and phase 2, we have the staff and the equipment and the supplies to manage. Once we get into phase 3, and that's when we start moving into alternate areas, that's where it's going to be much more challenging in terms of getting additional equipment such as beds, infusion pumps, monitors, because we will be then using space that is not traditionally used for healthcare. So phase 1 and 2, we feel very confident that we would be able to manage. Phase 3 and then phase 4 will require additional equipment, staff, and outside resources.
And a follow-up, Brian?
Sure. I know we're continuing to go with the monitors, but the gentleman from Strong had said they have 400. I'm assuming that's across the UR system. Do we have a total hard number of actual ventilators that we have, including Rochester Regional, presently?
Okay, Rob Mayo here, just conferring with my UR colleagues here. So they have 400 ventilators. Rochester Regional Health has approximately 240. And then many additional machines that can be adapted into ventilator capacity. And I'm sure U of R has those types of machines as well. I would also just like to respond to the previous question to let the press corps know that the governor and the State Commissioner of Health has queried all state licensed healthcare providers to ask those who are in retirement who is available to be helpful in this crisis, who's willing to be trained and to step in to help us. And so that's a very tremendous effort. It's currently evolving. I can't speak to all of its specifics, but it is reassuring to know that there are thousands of people across the state who are willing and eager to step in and help us in this crisis. So our traditional staffing models, our traditional ways of thinking about staffing are changing greatly. And that's evidence in the way that we're retraining people now, people who are working for us now and retraining them, as well as bringing people who have stepped for a time into retirement who are willing to jump back in and refresh their skills to help us. So I do feel very encouraged by those measures and feel optimistic that they will be very, very helpful in providing the care that we need for our community.
Brett Dahlberg from WXXI News is next, and Tanner Jubenville from 13 WAM standing by.
Hi all. What is the plan to get more ventilators if we need them?
So I can let the hospital systems weigh in here as well, but right now, in addition to the capacity that they can build within their systems using different machines, we communicate these needs and where we are in our ventilator capacity with the state of New York and our partners in government across the state as well, so that they understand where we are in our phases, so that if we do need additional equipment, that they understand where that is so they can readjust their resources as well. And that goes for supplies across the chain. I get questions a lot about supplies coming in like masks and other things like that. We communicate with the governor's office several times a day and about what our supply needs are to make sure that our hospital systems and healthcare systems throughout the community have the supplies they need every day. If there's a shortage anywhere in their supply chains, that we can manage that as well with our partners at the state.
And a follow-up, Brett?
Can I hear an answer to that question from the hospital staff?
This is Kathy Parnello. Yes, totally agree with what Adam just shared. At Strong, we actually have an order in for 20 ventilators, which we do believe, 20 additional ventilators, which we do believe are being shipped and will arrive. And we've made a request already to the State Health Department about the potential of needing 30 more. So we are really trying to get ahead of this. We also have a daily report that our supply chain folks manage in terms of the other personal protective equipment that we have. You know, what are the numbers we have on hand? What are the amount of those types of equipment and materials that we're using each day? So we are working diligently to stay on top of that, and then working with our county health department, the state health department, in terms of future and ongoing needs.
I can answer similarly to Kathy Parnello on behalf of Rochester Regional Health. Part of the importance of the surge planning that has been in the works now for a number of weeks is forecasting equipment needs. So our supply chain team has been on top of that. We have also placed orders for ventilator purchases as well as rentals and hemodialysis machines and other key pieces of equipment. So we have a daily report that is carefully measuring the utilization of those resources, the response to our supply chain requests, as well as the less complicated equipments like gloves and masks and other personal protective equipment. So all of those things are being tracked daily, and we work diligently with our supply chain partners.
Next up is Tanner Jubinville from 13 WHAM, and Julie Sherwood from Messenger Post Media should be standing by.
Hi, wondering about the possible field hospital. I was wondering if you could talk more about the locations being considered and the size you're looking for in terms of how many beds to fit in that hospital if it gets to that point.
Sure. Thank you, Tanner. So as I said, indicated before, we're looking at 4 different sites throughout Rochester. When one site is determined in partnership with the New York State Department of Health and our local Monroe County Health Department and the hospital systems, we'll obviously make that announcement. But in fairness to the owners of those facilities, we're not going to talk about the 4 individual sites themselves. But once we pick one, we'll be able to let the public know where that is. And the capacity, again, depends. You know, what we're looking at right now is a site that can do hopefully up to another 500 to 1,000 beds. That's the typical size of what the field hospitals are that they'd be setting up around the state and other parts of the country.
And a follow-up?
A follow-up I have for each hospital system. Would you say right now the biggest concern is trying to make space or trying to find staff, adequate staffing for potential surge?
Yeah, thank you. I think right now we have space. I think our concern is with our staff workforce. That's why it's so important that we protect them with proper PPE so that they don't become infected, so that they can continue to help the community. This is why it's also important for the community, if they're sick, to call their healthcare team, their physician, their provider, before coming to see them. Let's protect our workforce so that we'll have enough people to care for the community. So as Kathy Parnello said and Rob Mayo, for phase 1 and 2, we have enough staff. Phase 3 is where it becomes an issue, and this is where retired professionals could help, and other professionals that the state could provide. Thank you.
Thank you, Dr. Pastelakis. My answer is very similar. You know, one of the amazing things about healthcare providers is that they view their careers as a calling. They demonstrate incredible dedication and commitment, compassion to their patients. We are enormously fortunate in this community to have an abundance of these individuals who have been tested and tried through the years of their careers, and they're in this with us. So at this point, I would say that we've opened up a lot of capacity at all of the facilities in Monroe County and beyond through both health systems' Phase 1 efforts. And currently we have the staff. We will continue to support our staff through all of this and train new staff. And so I'm not sure, I can't say at any given point when staffing will become a serious matter in our capacity, but we will continue to communicate that with and partner here locally as well as across the state to adjust and fill gaps. Thank you.
Julie Sherwood from Messenger Post Media and Teddy Singer from Minority Reporter. You will follow her.
Hello, this is Julie. Can you hear me?
Yes.
Hi. Yes, I have two questions. My first one is about protective equipment for hospital staff. Where do we stand on that and with our hospitals in the region, all of them? Is there a shortage right now? What is the need there?
Right now, we have plenty of protective equipment for our frontline workers. We have at least a couple of weeks' supply there with more coming in. Once again, the amount of supply we have to protect our workers is directly proportional to the demand of the number of patients we're seeing. This is why social distancing is so important. Calling your physician before going to see him if you're having symptoms. We will have enough supply if we continue with our social distancing, and as Dr. Mayo said, if we don't allow it to fatigue us. I believe together we can work on this and have plenty to protect everybody.
And a follow-up, Julie? Julie, are you there?
Yes, I'm sorry. I muted at the wrong time. I wondered about the visitor policy in terms of, the social distancing and what you're trying to do to protect the staff. What is the policy right now? What do you foresee happening with that? And does the visitor policy differ depending on the department? For instance, with labor and delivery, is there a loved one able to be with the woman, in labor? And then how does that work in terms of the other departments in the hospital?
Rob Mayo here, just conferring with my U of R colleagues. Yeah, we are fully compliant with the current state regulations on this. And I'll just explain them briefly. There are a couple exceptions, but presently there are no visitors permitted in the hospitals. And certainly, under the exception rules, no one that has any symptoms. And so visitors are being screened at our doors. The exceptions to the no visitor policy are one visitor, a parent or a guardian to a child, one guardian to a cognitively disabled individual, one partner or coach for a laboring mother, and all of those exceptions, all those individuals must be symptom-free to enter the hospital. There are also regulations that have been applied to our nursing homes, that there are no visitors in nursing homes, and all employees there and patients are masked. Oh, I just recalled one other exception to the hospitals, which is one visitor for end-of-life or critical care situations. So that's an important exception. Any other questions about that?
No, thank you.
Thank you, Julie. Patty Singer from Minority Reporter is next.
Could I just answer that question for UR Medicine? This is one of the areas that we've worked very closely with our RHS to make sure that we have a community-wide standard for visitation, and I just want to assure the community that our visitation policies are the same, so that you shouldn't get different policies at different hospitals. Also, I did want to add to my prior comment about it's important for the public, if they're sick, to call their PCP. We realize that some patients don't have PCPs, And that's why on our UR Medicine website, you can find a number to call if you don't have a PCP of where you can go to get the care you need and notify us that you're coming and that you're ill.
Patty Singer, you're next for Minority Reporter, and Will Astor from Rochester Beacon should be standing by.
Hey, Julie, thank you. So people have pretty much exhausted the supply chain questions. I'd like to talk, perhaps Dr. Mendoza can answer this, about antibody testing. Seeing some articles surfacing that antibody testing it can be available. Wondering about that in our community, how that might work, and would that start to give us a truer sense of our numbers and perhaps even help predict a surge?
Sure. Thanks for your question, Patty. So to clarify, the current test that's available is a PCR test. The PCR test will look for active presence of the RNA genome in the host specimen. The idea of an antibody test is still a bit ways off. Unfortunately, we don't have that here available in this community. I understand that there are studies ongoing to develop that possibility, but currently we don't have that. But when we do, certainly we'll make that available here in Monroe County. And the purpose of that, of course, would be to determine if somebody has been infected in the past. So that would be useful in the future, but unfortunately we don't have that option available today.
So as a follow-up to that, then articles about that, being read about that, either those are internet myths that they're available, or they're just not ready for prime time yet. We don't want to be a test community to see if those tests are actually valid and reliable.
Correct. Those are not currently available, but certainly our community has stepped forward in the past to be a participant in studies and trials, but that's currently not available in general practice.
Thank you.
Thank you.
Will Astor from Rochester Beacon is next, followed by Kayla Green from News 8.
Yeah, hi. So do the phase 3 and 4 plans for lower include coordination between the systems for moving patients around in order to optimize bed availability, or are the systems on completely separate tracks?
Hi, Will. This is Kathy Parinello. Thank you for your question. We just conferred briefly here, and certainly our plans create capacity across the community. Certainly across the UR Medicine system, we do plan on transferring patients so that they get care in the place that's best for them for what they have. And as we were chatting here before coming to the podium, we've been working together, UR Medicine and Rochester Regional, so closely on so many things. We could envision, if the need arose, that we would be talking amongst each other and deciding where best might we take care of patients. So we haven't done any deliberate planning as yet, but we have been planning every day, I think, for the last several weeks, and would be certainly open, given the colleagueship that we have across the community, we'd be open to doing that.
And a follow-up, Will?
A different question. I know Dr. Zucker put out the call to retired and independent, whatever, medical personnel. Have any responded, and how much would be required to get them up to speed?
Good morning, Will. We have had a number of people respond directly to me, and so I can speak to the level of volunteerism that I've experienced from retired colleagues and colleagues who are not in retirement who are looking to expand their practice just to help out. All of the official volunteer ask, though, is going through the State Department of Health, and so we don't have those data available to us, but all I can say is that locally here in the community, from every walk of professional life, we've seen people stepping forward, really hoping to take care of one another. So I have to say that I'm really very grateful for what we're seeing here in Monroe County.
The next question comes from Kayla Green at News 8, and Kevin Oklupja from Rochester Business Journal will follow her.
Yes, hi. So obviously Governor Cuomo has been talking a lot in the past few days about the possibility of upstate having to help downstate or the opposite. but of course downstate has way more cases than us right now. So I'm just wondering if these plans are kind of taking that into account, or if you're expecting to have cases shipped from downstate up here.
So the focus that's been here regionally is in meeting the need that the governor set out to increase bed capacity in our community by 50% with a goal of 100%. And that's what the healthcare systems have done in laying out what those phases are. Right now, the need for us in our community to meet the needs of our residents here is directly related to how well we do social distancing and how well we keep our admissions to the hospitals down and free up bed capacity. So we are regional, but we are also one big community. So we are going to continue to build those bed capacities so that we can be a resource. But that's something that we haven't had to really cross with yet, because we're still trying to manage, and we also need the community here to manage how well we do social distancing to keep our numbers down as low as possible so that we do not experience the type of surge that exists right now with our neighbors down in New York City.
Yeah, so you guys also mentioned that doctors that are not currently practicing in their fields are being trained to treat COVID patients. So I'm just wondering how many people that roughly is and how many doctors you guys are preparing to treat COVID if there is a bigger explosion here.
Well, it goes beyond simply retired physicians. At URMC, we've been working with our entire faculty group, which includes our attendings, our residents, our fellows, to make sure, and our advanced practice providers, to make sure that we have enough providers to meet the need. Well, what do I mean? Since we've cut back on elective surgeries, and since we've cut back on outpatient visits, we've opened up time for current professionals to assist. And those are the people that we're working with to make sure that we have plenty of providers to backfill for any of our frontline staff who get ill. There's plenty of people, surgeons, for example, who have plenty of skills that would be very helpful in the intensive care units for sick patients. And they could work in teamwork with our intensivists who understand the physiology and the treatment of the critically ill. So we have a long list of people that we're pulling from, of professionals that we're pulling from, and we do have a list of retired individuals that we can call on as we need it as the phases go on.
I'd just like to add that I believe the community is well aware of the decades and decades history and commitment to educational programs at both the University of Rochester and at Rochester Regional Health. So the infrastructure is certainly in place for rapid education. We also have a framework in place to find providers and train them quickly. There is a marketplace that was implemented at Rochester Regional Health where current healthcare workers whose clinics are closed can go to this marketplace and say, oh, I'd like to work in this place. I will focus my training to support this area. So all these efforts are moving quickly and really have a lot of traction. I'd also just like to second what Kathy Parinello said earlier about collaboration across the community. Collaboration is vital. It's been alive and healthy and growing over the last months, and healthcare providers have an oath of duty to care for patients, and Rochester Regional Health is committed to collaborating and ensuring that the right care is provided across our community in whichever hospital our patients are being cared for. Thank you.
And our final question comes from Kevin Oklubja from Rochester Business Journal.
Yes, thank you. I'm wondering what sort of time frame it would take to get the field hospital functional, and then also, I guess I'll throw the follow-up at the same time, what sort of ICU or hospitalization numbers would sort of trigger that creation of that field hospital?
I can speak to the first question, which is how long that would take to do that. We're actually meeting with the Army Corps of Engineers and New York State to determine those now. Those types of field hospitals can go up very, very quickly, though. That's something that the state and federal governments can do across the country and across the state, and they go up, like I said, I think within days. So those can be done very quickly, which is why we're planning now to have that in place so that we know exactly what supplies, personnel, and locations we'll need in the event that we need to get to that phase and be able to do that. And I'll let one of the hospital systems speak to the other follow-up of your question.
Yes, the plans that have been developed across URMC and Rochester Regional actually result in about 2,000 beds being added. So today, across the two systems, there's about 2,000 beds that are in use today, and this capacity planning brings in another 2,000 beds. And that's with the understanding that about 600 of those beds are beds that have been vacated out of our baseline. So it wouldn't be until we're beyond that point that we would need to trigger a phase 4, which Adam just described, which would be the field hospital. And just to say again, we hope we don't need to go to phase 4, because if we continue the social distancing that has been started in this community, it is likely that that curve will be, the slope of that curve will be softened so that we don't have the need for that many patients to be hospitalized at one time. But if we do, if that happens and we need that, it would be after we've utilized the hospital capacity that you heard about.
Thank you. I would like to again thank the Rochester Press Corps for working with us and WXXI for hosting us today to be able to do these updates to the community and be able to answer your questions in a safe and healthy manner. I also want to thank our partners at the hospital systems and healthcare workers across this community who are collaborating. We're very unique here in Rochester, I think, in that while we have two of the best healthcare systems that we could ask for, we're also very blessed that we have the collaboration and the level of collaboration that we have working with us. And I see this across sectors around the community with our hospital systems, again, our law enforcement, EMS, fire, community, our nursing homes, skilled nursing facilities. I see it all across the community, our community-based organization, nonprofits. Everyone's stepping up right now to work together, to collaborate. And sometimes I think in the past, it's, sometimes I like to use this phrase that it's easy to cooperate with one another and work side by side. Collaboration is what's difficult. And in this community, we've seen a lot of leaders step up to really collaborate to get the job done. But the other theme that I'd like people to just take away from today is that as we continue to build out those phases and work with our hospital systems to do that, the need to grow out those phases is directly relatable to how well the rest of us in the community take to heart the social distancing practices that we've been advised to do. Over the last 10 days, I get that it's been difficult. There's a lot of stress, there's a lot of anxiety related to this, and we can get tired of it. And you're probably all very tired of hearing me say we need to socially distance ourselves. But we have to keep it up. Socially distancing each other is what is saving lives. It is what is going to lower the spread of this disease. It is what is going to give our hospital systems the ability to stay on top of the capacity needs as we've been able to do over the last several days, so that we can stay on top of this so that it doesn't turn out to what we've seen other places around the world spiral into. So we all have that role to play, and the better we do at listening to the advice of professionals, the medical community, and your local and state and federal leaders is directly relatable to how successful we will be as a community. So while I know this is tiring, and I know that there's not really great answers as to when this will end, I'm going to ask everybody to keep putting their 2 feet forward, stay home, stay socially distant, but look for other ways that we can connect, because we are social beings. We use Zoom and WebEx and things like that in my household to communicate with my kids' grandparents, and we do this with meetings and staff meetings, and we do this all the time to check in with neighbors. These are the types of things we can do to stay social, but also remain a safe distance from each other. We can go outside. We can enjoy the weather as long as we're staying apart from each other. And I can see that we're doing that. I can see that out in the community. We just have to keep that up for some additional time. And the better we do that and the better we stay apart from each other physically in a healthy way, the better we'll get through this, and we'll be able to manage whatever surge capacity or in whatever surge in the disease that our community faces. So thank you. Thank you, thank you to everyone in this community for your partnership. Thank you to the media, and thank you for all of those essential workers, from the grocery stores to the hospital systems to our first responders all across this community. Thank you for what you're doing, and our pledge to you will be that the rest of us in this community who are not out there in an essential business, who can stay home, we will stay home to protect you and to protect your families as well. Thank you.